Amongst the different professions or disciplines within medicine, radiology is amongst the youngest. We're just, after all, 130 years old. Röntgen discovered X-rays only in 1895. But despite being the youngest profession, it is also one of the most rewarding and most fulfilling. Nearly 80 to 85% of patients passing through any aspect of the healthcare, whether it's outpatients or inpatients or the emergency room, 80 to 85% of them will pass through radiology as part of their healthcare journey. And more often than not, almost up to 50% of the times, the diagnosis will actually come from radiology. So the role that radiologists, whether they are diagnostic radiologists or interventional radiologists or interventional neuroradiologists, the role that radiologists play in healthcare is immense. The value of the radiologist lies not only looking after our patients or caring for our patients, but also giving some valuable advice with regards to management and prognosis to our referring colleagues, to our referring clinician friends. In that sense, we are actually the clinician's clinician. We are the doctor's doctor, so to say.
I chose radiology and nuclear medicine as a subspecialty, as it is a unique blend of cutting-edge technology and patient-centered care, in which we play a critical role in the era of precision medicine and personalised treatment. The unique combination of conventional structural imaging with molecular imaging at the receptor level enables comprehensive analysis of disease morphology and behaviour, enhancing diagnostic precision. This allows for early detection of imaging before it becomes visible on structural imaging by imaging molecular targets, for example, PSMA receptor in prostate imaging, amyloid in Alzheimer's disease, and somatostatin receptors in neuroendocrine tumours, just to name a few. It also allows selection of patients for targeted radionuclide therapy, which aligns with the biological tumour characteristics of the patient, therefore individualising patient treatment. And this leads to the emerging role of theranostics, which is a combination of therapy and diagnostics. This is a cutting-edge approach in which a single radiopharmaceutical agent is used to both visualise and diagnose disease through imaging of specific receptors which are overexpressed in certain cancer cells, and precision targeted radiation treatment by targeting those same receptors. So imaging is not limited to oncology, but it is also applicable in monitoring neurodegenerative diseases, cardiac conditions, and evaluation of inflammatory conditions as well. One of the most exciting advances is PET MRI, which combines metabolic imaging power of PET with superior soft tissue contrast of MRI, improving diagnostic precision. This hybrid imaging modality is showing promise in neuroimaging, where accurate structural and functional mapping is crucial in the evaluation of epilepsy and brain tumours, paediatric oncology due to reduced radiation dose compared to PET-CT, and imaging of prostate and gynecological cancers, as pelvic MRI provides superior high-resolution imaging, further enhancing diagnostic capability.
What I love about radiology is its collaborative approach to patient care, which includes close interaction with surgeons, oncologists, and other specialties. As a radiologist, you are a vital part of the MDT that help with vital decisions in real life for real people. MDT meetings are not only valuable for a high standard integrated patient care, but also an invaluable learning opportunity. Behind every scan is a patient whose care depends on precision, where we play a key active role in treatment planning and monitoring, especially in oncology. Whether it is avoiding unnecessary biopsies or directing the surgeon for precise location to biopsy by mapping prostate cancer on MRI for fusion image-guided biopsy, or, for example, by localizing a breast lesion for precise excision. One of the benefits of radiology as a profession is a flexible work-life balance. It gives you more predictable and flexible working hours compared to other specialties. As a working mom, for me, just be able to adjust the work with all the school events is a very valuable benefit. Working as a breast radiologist is extremely rewarding. by early detection of a non-clinical cancer, you can completely change a family life. It's not just one person with breast, it's usually a family, because sometimes a young mother is involved, and that would completely change the scenario for the family from going towards the minor procedure, less invasive treatment, and better outcome.
If you enjoy doing procedures, interventional radiology is a minimally invasive form of surgery. If you enjoy a procedural lifestyle and you wish to be at the forefront of the patient's journey and make a difference, an acute difference in a patient's life, interventional radiology can provide that for you. The other thing is, with interventional radiology, we do get to work with advanced imaging technology as well as advanced treatment technology. Many of the procedures we do with an access needle no larger than a pinhole. In my career as an interventional radiologist, I have been very fortunate to witness transformational change in the treatment of stroke. In 2015, 5 trials came out that proved that endovascular clot retrieval was safe and was effective and transformed the management of stroke overnight. I have been also fortunate to witness in my lifetime the changes with pulmonary embolism treatment. I can see the same thing is happening with the treatment of pulmonary embolism, whereas before we didn't have an effective procedure and patients could have died. We now have an effective procedure that is safe, fast, and immediately effective and is saving lives.
There is a persistent shortage of clinical radiologists across Australia and New Zealand in the rural and regional areas. This is something that the Royal College of Radiology has been trying to address for quite some time. But recently what we've launched is the Rural and Regional Training Program, or the RRTP, where the trainees would be spending most of their time of training in a rural regional setting and then coming to the metro for some specialized experiential requirements. What we're hoping this would do is that this would enable people to see a rural and regional settings and probably grow with that community and stay there. That will go a long way in addressing this inequity of access, inequity of workforce spread, which is around both countries. RANZCR, as a member organization, is committed to promoting diversity, equity, and inclusivity. And we want to promote this throughout the ranks of the college. So throughout our membership and the committee structure, and also through all of our governance structures. Also, the college board set up the Diversity, Inclusivity and Equity Task Force a few years ago, and that has made some really comprehensive recommendations which the college is in the process of implementing now. We believe that the future of the college lies in collaboration, and therefore diversity, equity and inclusivity in one of our pillars, and we want to be one of our strengths. This is the 27th year of me being a clinical radiologist. And if I were to go back and do medicine again as a career, for sure I would be choosing radiology. It definitely keeps you on your toes because you're learning something new every single day. It is a fascinating piece because technology is also advancing and you get to see the newest pieces of technology coming to the world of medicine or via radiology. If you want to make an impact in clinical medicine, if you actually want to make a difference, I would urge all of you to come over to the brighter side, come to radiology.